and because the nucleus, the abducens nucleus for horizontal movements is in the right pons for right saccades, then the right pons would also be engaged here. The same is true for the exact opposite. Just reverse what I said. So left saccades, right frontal lobe, left cerebellum, left pons. What about vertical saccades? And that's a great frontal lobe, just bilateral frontal lobe stimulation. Bilateral frontal, bilateral cerebellum, and bilateral midbrain or mesencephalon. If you want to stimulate the parietal lobe, then you want to use your pursuits. Of course, optokinetic system will do that too. If it's a look OPK, the slow phase or the pursuit phase of the OPK is more parietal. And from a visual field standpoint, so if you're familiar with hemistim stimulation, a visual stimulation, in the lower field of view would stimulate the parietal lobe. So this is I'm not going to play it, but if we're to do a right pursuit, so if I'm the patient pursuing to the right, this would activate the parietal lobe on the right side and the cerebellum on the left side, as well as the pons on the right side. Same is true with the left, to reverse everything. On the vertical, so if you pursue it on the vertical, bilateral parietal lobe, bilateral cerebellum, bilateral pons, bilateral mesencephalon, so pretty global effect. But what if we combine saccades and pursuits? And this is where it gets even greater. So if you combine saccades and pursuit, you can really isolate a hemisphere completely. So if I wanted to do a left brain type of eye movement strategy, this is what was used, by the way, in that study that I mentioned earlier by Dr. Carrick, which was on stroke patients. They used this strategy. There are saccades that move up into, saccades that move up into the right for a left brain or left frontal lobe effect, and pursue back down into the left. I'm sorry, saccade up into the right for the left frontal lobe, pursuit back down to the left for the left parietal lobe. But I don't know if you've noticed, but only one side of the mesencephalon is highlighted here. So this is the only way you can isolate left or right mesencephalon if you have this diagonal strategy here. Same is true for the reversed direction here for the right brain. And temporal lobe stimulation is upper field of view. So right upper field is left temporal, left upper field is right temporal. I'm sorry, I'm going to really go fast through these. On our website, the focusbuilderapp.com, we actually have a guide for hemistim that we've created. It's a PDF. You can just go on there and open it and download it or print it for yourself. But basically, the parietal lobe and the temporal lobe have different responses to vision. And so the parietal lobe is activated more so through low contrast, high processing speed, the blue end of the spectrum of light or color, and large stimulus and lower field of view. Temporal lobe is the exact opposite. This is an example of a left temporal strategy. This is an example of a right parietal lobe strategy. So see the blinking is a little faster. The squares are a little bit larger. The colors are different. Lower field of view. The right brain and left brain actually are kind of similar to, so the right brain is similar to the parietal criteria, and the left brain is similar to the temporal. So what you see on the right brain, again, is big picture, high frequency, blue end of the spectrum, large stimulus, low contrast. Exact opposite for the left brain. And this would be a right hemispheric strategy and a left hemispheric strategy. Cerebellum is especially involved in accuracy, but if you really want to engage your cerebellum, consider the diagonal strategies. Those are pretty powerful for that. So, lastly, I don't want to leave this out. we decided to combine saccades with a manual task and interactive metronome. We did that because there's lots of evidence out there that saccades are so effective at activating the frontal lobe, the cerebellum. Same thing with the interactive metronome. They both target similar regions. But what if we made it very specific? Well, this is an example of, I don't know, you may not be able to hear it. There's a ding with every, so there's an auditory cue with a visual cue, and what you have to do is touch the target at the same time that it beats. And if you get it on time, it lights up green. If you get it late, it lights up red. If you get it early, it lights up yellow. Okay, so it gives you feedback, and you can adjust your speed.